Hey guys, so in today's video, I wanted to talk about having some guilt as a healthcare worker. And this is something that I used to get all the time. So I used to feel super guilty because, like, if I had to call off or if I was sick, um, I always used to feel really guilty because I felt like I would be leaving my coworkers, like, struggling to try to complete their daily tasks. And I just want to say that I think it's kind of ridiculous that healthcare workers feel that guilt. And a lot of times it doesn't just come from ourselves, a lot of times it comes from our managers, our supervisors, because we are made to feel guilty if we need to take time off because they say, well, you're supposed to care for your patients and blah, blah, blah. Like they put you on a guilt trip big time, especially if you have to call out more than just one day in a row. Like I have worked at facilities where I literally was in the hospital with a stroke and got written up. Like I had a stroke, a major stroke, and I got written up for being absent. So, if that tells you anything about the state of healthcare, that should tell you why a lot of people that work in healthcare, a lot of CNAs and nurses and medical assistants, and just healthcare workers in general, have a little bit of disdain for the way things are going. Um, I just want to say that if you are a person who works in healthcare and you feel like you would not be able to care for patients or you would not be able to carry out your job duties on any given day because of the way that you feel, if you feel sick, please don't go to work. Like, I never understood, especially during COVID and things like that. Like, I used to work on a trach unit, for those of you who didn't know, as a CNA. And they wanted us to come whether we were sick or not. And I never really understood that because people who are on trachs, you want me coughing and sneezing and everything else around them. Like, even with a mask, I don't feel like that's safe for the patients, especially somebody who's already bedbound, already completely dependent on other people for everything within their daily life. Um, I've just never understood that. And I wish that we worked in a society or lived in a society that didn't put so much emphasis on what you bring to the table um, as far as work. Because I don't know, I feel like it is sad the emphasis that they put on whether or not you were able to go to work that day. It's just really sad. Um, so yeah, I don't really know. Like I said, I used to feel super super guilty. Like there were days, especially during COVID, where I was really sick. Like I got COVID from my stepson and was exposed to COVID multiple times from my stepson. And like I ended up calling in because during that time, if you were even exposed, you had to quarantine. And like this was at the very beginning of COVID. And now it's like they just expect us to work, whether you have COVID, whether you have pneumonia, whether you have the flu, whatever it is that you have, they just expect you to be at work. And I just think that it's really sad that we've gotten to this point because people wonder, like I said, why nurses are feeling burnt out, why nurses don't want to work anymore, why people don't want to work in healthcare. And when you work in an environment like that where you aren't even given the time off to recuperate when you're sick, like there have been times where I have felt completely awful. There are times where, not at my current job, but there are times where I have had to like go to work where I'm throwing up. I'm literally like taking care of patients, going to throw up, washing my hands, going back to take care of another patient. It's disgusting and it's unhealthy and it's unsanitary. And I don't know why I'm even telling you guys this, but I just want you to know if you are a healthcare worker like myself who feels the need to take a day off to recuperate, whether it is a physical ailment, whether it is mental health related, whether you just feel completely stressed out and you just can't do it anymore, take that day off for yourself and don't let them make you feel guilty for it. Because this is how I see it. I see it as if you can't take a day off to take care of yourself, how does anyone expect you to care for other people? You have to prioritize your own health and safety and wellness over everyone else, because you're not going to be a good caregiver regardless of what your job is. You are not going to be a good caregiver if you don't take the time to take care of yourself. You are the number one priority. Please remember that. So I am actually going to go into work because it is 7:14, and today is the last day that my coworker is here. He is retiring today, so this will be kind of the start of a bunch of stress for me, because we're going to be one less coworker or one less employee in the cardiopulmonary department and sleep department. So we're going to have to do some more flexing of the schedule to kind of figure out coverage for that. But thankfully, we only have one provider here. Not today, though. He's not here until Thursday. We have the sleep doctor here on Thursday, which is weird because he's hardly ever here on Thursdays. But it is what it is. I am going to take some time to do some stuff for next month. Yesterday was Memorial Day, so I'm going to get everything ready for June, as far as like the crash cart checklist and the fridge temperature log, and I will probably work on July's calendar book pages. So anyways, I'm going to go inside, like I said. So please prioritize yourself. Take care of yourself. If you feel like you need a break, take a break. Take a day off. You deserve it. End of rant. Anyways, I hope you guys are having a wonderful day, and I will talk to you guys next time.